I am Chris Lakakis, and this is my persuasive speech on physician-assisted suicide. And this is my audience. I'm sure most of you know of something called physician-assisted suicide, also known as euthanasia. Or I'm sure most of you have had a family member, close friend, or a friend of your parents or grandparents that has had a terminal illness or disease. For example, cancer, multiple sclerosis, and Lou Gehrig's disease, which often, if not always, cause severe pain in later stages and progression. Many of the people who are diagnosed with these terminally ill diseases have nowhere to go for help, and no one seems to put themselves in their shoes to care. A man named Dr. Jack Kevorkian realized this manner of those who were suffering, in which he came up with the performance of physician-assisted suicide. Physician-assisted suicide is illegal in the United States, in which many think it should be legal, including my perspective. I would like to tell you today the positives and rights people should have to assisted suicide. A famous doctor, Dr. Jack Kevorkian, who is known for his PAS career and a story of a terminally ill patient who chose to end his pain with PAS. The most important aspect of the perspective of making the PAS legal is the positive factors and the rights of those who suffer from a terminally ill disease. There are many positive factors and rights people should have to physician-assisted suicide. Some of those positives include that legalizing euthanasia would help alleviate suffering of terminally ill patients and or family members. It would be inhumane and unfair to make them endure the unbearable pain. In an attempt to provide medical and emotional care to a patient, a doctor should do all he or she can to make their patient comfortable in a long life of pain that involves prescribing medicines that will relieve his or her suffering, even if the medications cause gross side effects. Another long and striving problem that comes with the disease and curing the pain is money. A patient who is living in pain and misery that will never be able to cure the disease is also paying for all the help of their family. It has to deal with affording the needs to be comfortable. If the patient was able to choose their death, those problems would be taken care of along with the pain. Euthanasia should also be an extension to a patient's rights, allowing him or her decision of life or death. Maintaining life support systems against the patient's wish is considered unethical by law, as well as medical philosophy told to us by Dr. Macy in her article on Buzzle.com. To help you become more informed of my perspective of euthanasia being a successful and positive procedure, I am going to tell you about a famous doctor who practiced PAS named Dr. Jack Kevorkian, followed by a success story that he performed on a patient, Thomas Hyde, that was noticed by the public. Dr. Jack Kevorkian was born in Pontiac, Michigan on May 26, 1928. Kevorkian is a right-to-die activist who famously said that dying is not a crime. Dr. Kevorkian assisted in the deaths of 133 terminally ill people, according to his lawyer, Jeffrey Feiger. Kevorkian accomplished these procedures by allegedly hooking up an euthanasia device that he had made. One of the devices used consisted of a release of drugs and chemicals through an IV, which he called a thanatron. The other device entailed a gas mask fed by a canister of carbon monoxide that was referred to as a mercitron. Kevorkian's medical license was revoked, and he was sentenced to 10 to 25 years for second-degree murder. But he was released on parole in 2007 when he was convinced the Department of Corrections that his hepatitis was imminent within months. Kevorkian is very famous for participating in the PAS. All of Dr. Kevorkian's PAS are very serious, but one of his patients seems to be most recognized. One of Kevorkian's most famous PAS procedure consisted of a patient named Thomas Hyde. Hyde was a 30-year-old man who was Kevorkian's 17th patient who participated in the physician-assisted suicide. Hyde, who has been diagnosed with Lou Gehrig's disease for a year, finally wrote Kevorkian to meet with him and his fiancée to discuss Hyde's wish to die. 2 months after the letter was written, Kevorkian and Hyde met. It was just a short matter of time before Hyde would be in danger of dying from choking on his own saliva from the loss of muscle control. 34 days late after meeting Kevorkian, Hyde died from the Mercitron, which was the gas mask that fed with carbon monoxide, a device that was assembled from Kevorkian himself. After the PS that Dr. Kevorkian performed on Hyde, newscasters couldn't wait to get their hands on the story. Thomas's story was then after told on Frontline News and was also located on PBS.com. It should be evident that a policy such as euthanasia should be considered over again within the future to become legalized. From the positives that come from the PS, considering cure of pain that comes from it and the good God-given right for a person to end their suffering, it should be thought about. Dr. Jack Kevorkian did not decide the patient's life for them. The patient did. The patients wouldn't have asked Kevorkian to assist them if they didn't want him to. Along with Thomas Hyde's decision should have been his own, no one else's. A person should consider the saying, what if you were in those shoes? So in the future, I hope none of you will have to make the decision like euthanasia in your own life or go through it with a family member. But if you ever do, this is what you need to do for us to implement this policy. In the future, keep people informed of the importance of a person's right to choose when they end their life, and also try for every chance you get to vote of these issues and bring it up at the places that matter most. I also want to leave you with a question. Would you want to live your life in pain and suffering? And wouldn't you want to be the one in charge of your own life when it comes down to it, like we are supposed to be? And then I also have a map of places in the world where euthanasia or assisted suicide are legal, which is the ones in yellow, which is the Netherlands, Washington, which is yellow, and Oregon, and then Belgium, which is this red dot, and then the Netherlands, which is green. And then I have a picture of Dr. Jack Kevorkian himself. This is the Thantron, where the drugs or chemicals were released through an IV. And that is my speech.